Hi, my name is Mayana Peters and I will be doing part 1 of influenza. So an overview of influenza, commonly called the flu, is not the same as the stomach flu viruses that cause diarrhea and vomiting. It is typically more severe and aggravating than the common cold, but most flu sufferers recover in 1 to 2 weeks. It can cause mild to severe illness and at times can lead to death. The best way to prevent the flu is by getting a flu vaccine every year. So people that are at a higher risk of developing the flu complications include young children under 5, and especially those under 2 years, adults older than 65, residents of nursing homes and other long-term care facilities, and pregnant women and women up to 2 weeks postpartum, people with weakened immune systems, people who have chronic illnesses, and people who are very obese. Some signs and symptoms of flu include fever or feeling feverish/chills, cough, sore throat, runny or stuffy nose, muscle or body aches, especially in your back, arms, and legs, headaches, fatigue, dry persistent cough, nasal congestion, and some people may have vomiting and diarrhea, though this is more common in young children than in adults. One of the causes of the flu is that the flu viruses travel through the air in droplets when someone with the infection coughs, sneezes, or talks. You can inhale the droplets directly, or you can pick up the germs from an object such as a telephone or a computer keyboard, and then you transfer them to your eyes, nose, or mouth. The flu can spread in mainly, as I stated before, the droplets. Less often people might get the flu by touching a surface or object that has the flu virus on it, and then touching their own mouth, nose, or possibly their eyes.
Hi, my name is Rachel Sutton, and I'm going to be reading the second half of the flu, influenza. So, periods of contagiousness. You may be able to pass on the flu to someone else before you know you're sick. Although people with the flu are often most contagious within the first 3 to 4 days after their illness, they are sometimes otherwise healthy adults that may be able to infect others beginning 1 day before the symptom develops and up to 5 to 7 days after becoming sick. Some risk factors that may increase your risk of developing influenza or its complications include age, living or working conditions, weakened immune system, chronic illnesses, pregnancy, and obesity. Some complications that may develop as a result of influenza can include pneumonia, bronchitis, asthma flare-ups, heart problems, ear infections, and sinus infections. Pneumonia is the most serious complication, and for older people and older adults, this is a chronic illness and it can be deadly. Preventing seasonal flu. The first and most important step in preventing the flu is getting the vaccine each year. The CDC also recommends everyday preventive actions, such as staying away from people who are sick, washing your hands a lot, covering your mouth when you cough, and it helps slow the spread of germs that cause the respiratory, nose, throat, and lungs illnesses like the flu to stay at bay. Lastly, diagnosing the flu. It is very difficult to distinguish the flu from other viral or bacterial causes of respiratory illnesses on the basis of symptoms alone. And there are many tests that are available to diagnose whether or not you have the flu.